San Diego's proximity to the border makes it a key part of the fentanyl supply chain, and it's likely to stay that way, according to the U.S. Attorney for the Southern District of California, Tara McGrath.
We are a transition point for the arrival of fentanyl. And what I mean by that is that we're a transportation hub. The fentanyl comes in through the Mexican border and then transfers up to distribution hubs like Los Angeles and Las Vegas, and then gets distributed to the rest of the country.
Now, it's inevitable that some of that supply stays in San Diego, feeding the local demand for fentanyl, with tragic consequences. Overdose deaths have skyrocketed in San Diego County, from less than 100 to more than 800 in recent years. It's a grim reality that San Diego District Attorney Summer Stephan is all too familiar with.
We've made fighting fentanyl a priority because we are ground zero for it.
But there are signs of hope. For the first time since the fentanyl crisis began, the number of overdose deaths has leveled off and even began to go down.
San Diego sort of uniquely has shown a 7% reduction in the number of fentanyl overdoses in 2023 as compared to 2022 and 2021.
Yet, with nearly 750 fentanyl deaths countywide last year, Stephan is hardly celebrating. Instead, her office and public health experts are studying a shift in how people use the drug and what that might mean for the future.
So while in 2019, 2020, we never saw cases where somebody was seeking or asking for fentanyl, now in 2024, we have many cases where the victims ask specifically to get fentanyl.
April Ella is the Director of Operations for A New Path, a drug treatment organization based in San Diego. She says there's been an evolution in how people use fentanyl. Just a few years ago, most people took it by accident.
People who are searching for fentanyl, where they start maybe trying to get like a Xanax or that was laced with fentanyl, they realize fentanyl's in it. They might get a little bit more addicted to it, drop the whole Xanax portion, and go towards fentanyl.
Experts tell KPBS that fentanyl is now much easier and cheaper to get in San Diego than heroin. Advocates credit the drop in deaths to the overdose reversal drug naloxone, which goes by the brand name of Narcan. But fewer overdose deaths does not necessarily mean fewer overdoses. Ella says that non-fatal overdoses are extremely difficult to track.
If they didn't go to the hospital, or they didn't get arrested, or they didn't get, some sort of care of some sort, even calling a helpline or something like that, there's no way to really track how many people are overdosing every single day.
And despite the lack of reliable data, A New Path has seen more demand for naloxone, which suggests that more people are overdosing, or at the very least, are at risk of overdosing.
When we're out in the field, people will report, I used 3 of those kits. I used 3 of those kits on my brother, whoever, my roommate, something like that. But that doesn't mean that gets reported anywhere.
Prosecutors agree that naloxone is making a difference, but they also credit increased collaboration among law enforcement agencies. Federal prosecutors work closely with the FBI, DEA, Border Patrol, and local law enforcement to go after large drug smuggling operations.
Identify and dismantle the cartels. That's what the U.S. Attorney's Office does. That's our unique piece of the puzzle in fighting fentanyl and other narcotics.
District Attorney Stephan says tougher drug sentencing laws are also needed. Meanwhile, advocates like Ella say that would be a return to failed policies of the war on drugs. Gustavo Solis, KPBS News.